are wired or wiped out, your child's behavior may be a clue to what's actually happening in their nervous system. Hi, I'm Dr. Roseann, and we are continuing our conversation about the nervous system and dysregulation. And today we're talking about nervous system imbalances in kids. What is overstimulation? What is understimulation? Because I really want you to reframe your idea of what's driving your kids' behavior because science shows us the way to not just the understanding of what's happening, but gives you the tools to make that change and be different so that your family can be calmer. The whole family gets dysregulated when you've got a dysregulated kid. I know, I'm a mom. So if you're new to me and you're looking for help, you can go to drroseann.com/help. And that's our solution matcher. And it's going to guide you to the right solution for where you're at because we're all in different places. And sometimes we're new in the discovery process. And this is a conversation. It doesn't matter if you're new to me, you're new to natural solutions, parenting solutions, or you're a veteran. A lot of the parents that follow me, I feel like, have a PhD in their kids' issue. And I love that because you really should be the CEO of your family and your child's well-being. And unfortunately, the way that our archaic mental health system is, that's what you have to do. And so own it and do it and go in there to your doctor, with notes and research citations and all that you need, because that's how you get your kid the right help. So we are really talking about this nervous system. What happens, to, a nervous system that experiences over or under stimulation. And I want to get more specific about some of the behaviors that you see. Before we do that, let's talk about some of the factors that impact us, right? So, first of all, there's stress, whether it's real or perceived, it doesn't matter if it's good or it's bad. So, good stress, you have a new baby in the house, you have an adorable puppy, you're moving, or bad stress. Somebody lost their job at home, your kid's being bullied, they are failing in school. Your brain does not know the difference. Your nervous system doesn't know the difference in that it's going to react in the same way. You're going to get a flooding of cortisol, until your frontal lobes tell it to shut down. It's not going to shut down. And what happens is this chemical cascade that moves you into an activation. In the last video, we talked about our autonomic nervous system, and this is all part of the autonomic nervous system, that you will move into a state that your body has to protect itself. And there's chemicals involved, there's all kinds of things involved. And the more you activate, the more you activate. So moving into that relaxed parasympathetic state is important regularly, because if you are constantly moving into a sympathetic dominant state, your body will continue to move in that direction. If it knows to go back to a parasympathetic state and it's been regularly doing that, it's much more likely. So we get stressed, it activates, and then it goes down. So that is really important, because you say to yourself, why does my kid is stuck, right? So stress can be a number of factors. So our environment affects us, right? So that's a lot of things, right? That's our learning environment, our home environment. It could be chemicals, infections and toxins, or a whole other thing. But there are many things in our environment that can be helpers or hurters, is what I like to call it. And so the list can go on, right? Certainly beyond stress or traumatic events, right? And there's a long list, right? There's big T's, big traumas, and little traumas. A lot of my families experience medical trauma. Gaslighting can be very traumatic from a physician or a provider of some kind. These are big deals. Device usage can really, really activate a nervous system, as well as just after as little as 20 minutes, it actually moves it into an understimulated state. And the blue light that comes through is a major, major factor in that. television and not watching it on your device is not as impactful. We know this through research, okay? Um, Having peer issues, learning issues, these are all activators, things that impact the nervous system and move it into that under or overstimulated state, as well as having a clinical issue. So, neurological issues, having a neurodivergent brain, these are all factors that impact how your nervous system is functioning. And, some of the things can cause us to impact in a positive way too, but we're here talking about kids that are struggling in some way, shape, or form. And kids are from little kids to adult kids, okay? And how about having a lack of skills? So, having a lack of skills, coping skills to manage stress, right? Having a low stress tolerance. These are all things that cause our nervous system to get under or overstimulated, right? And so when we think about the brain, the body, our behaviors, right? The behaviors, the understimulated behaviors and the overstimulated behaviors are just a reflection of what is actually happening with inside the nervous system. They are outward clues. And so what I want parents to do, right? Part of our comms method is not to personalize behavior. And so we have to be a detective and we have to look at it, at the clues, right? So, what are signs that your child has an understimulated nervous system? And know that you can have combinations of both. It's just that these functions, right? A lot of times, like before I did QEG brain maps, if you don't know what that is, go and listen to those episodes. I would listen, right? I was trained, doing neuropsych testing, psychoed testing, and so I would listen and I would say, okay, so they can't complete a task. They don't have time blindness. They don't, they do have time blindness. I then would say, well, that part of the brain is this. It's the frontal lobes, right? So I would reverse map it. Then once I had the brain map, I literally just like look at a brain map. I have the really short intake form. I look at the brain map and I'm like, you can't do this, you can't do that. Oh, you're really good at this. And people just sit there with their jaw hanging open. And their mouth hanging open. So when that happens, it's because I know the brain. And so, but in the same way, these behaviors will tell us exactly what's going on, right? So if you have a kid and they're understimulated, what are you going to see? Problems with focus, problems with listening, zoning out, disengagement or low motivation. They're easily bored. And maybe they have troubles with, learning, sluggish processing. They might be anxious in the way where they pull back, they shut down. You might see depression in that way. So you start to see these behaviors that are not as observable. These are a lot of internal behaviors, but when it comes to things like learning and listening, over time you really start to make the connection, right? What's going on? What's happening in the nervous system to do that, right? And stress of all kinds one of the biggest impactors of everything. 70% of all physician visits are related to stress. 70%. And once you have that stress and that nervous system is under or overstimulated, you're just not able to process. And you can really look like you have a clinical issue, or your clinical issue can be way worse. And that's why it's so important to really practice that regulation and calming the nervous system. So, what do we see in an overstimulated nervous system? We see hyperactivity, we see impulsive behaviors, we see anger and frustration, trouble calming down after meltdowns because you have a lot more meltdowns. You're going and meltdowns, just meltdowns and tantrums for kids of all ages are normal. It's the frequency of them, it's the intensity of them, and it's the duration and recovery. So if you're having, your kids of any age, like, even 11, and they're having a meltdown here and there, that's pretty normal. But if they're having meltdowns a lot, or it takes them, 3 hours to recover, you got yourself a problem, right? And, so that is critical in understanding what do we do, right? So I think it's really important to talk about triggers and understanding your child's needs. So, when you're practicing our comms method, go back and listen to the episode before, and there's another episode on it too. Um, when you're practicing it, right, you are regulating. And so that means you can don't personalize the behavior. And so you can put your detective hat on and you can be more investigative. Like, okay, we laugh about people being hangry, but maybe your kid is not eating at school because they're on ADD meds. And when they get home, they're just, totally out of it. And so you're having all this conflict. So instead of running to get another dose of, whatever stimulant you're on, why don't you think about what's a transition like? Right. The trigger could be hunger. It could be the lack of, it could be transition. It could be sensory needs. Start looking differently at what's there, right? Don't rush to the I almost said the pharmacist, but the psychiatrist, and really make sure understanding what those triggers are and then mapping it to the needs. And this requires patience. It requires, an investigative kind of mind, and know that you have to explore options. And certainly, you can always uh, get help. I mean, this is what therapists are for. This is what people are in our dysregulation solution, right? And so, the question becomes, when do you seek help? You seek help. Nobody ever regrets getting help. They only regret when they don't. That is the number one thing people come to me and say, that I regret I didn't do this earlier. I can't tell you how much that happens. In fact, I'm actually astounded how often people call us and have no barriers in terms of getting to see me, paying to come to see me, and they're just stuck in analysis paralysis and they don't take action. And it's very common. I mean, very common for people to call us back months or even years later in a full on crisis. And I will never make people feel bad, but they first words out of their mouth is, I wish I had done this earlier. And so I implore people, like, if you need help, don't be ashamed. Get help. So if you feel like you need help, you need help. I think the question becomes, who do you get help from? Well, you can always get help with me. We have lots of different ways to get help. That's what our solution matcher is for, drroseann.com/help. But don't go to some, influencer who's, just a mom, no clinical experience. Not going to get you where you need to go. I mean, that's just silly. Go to somebody who's got experience, whether it's locally and it's a licensed professional, and how do you find them? Google your specific issue and find somebody who's licensed in that area. Ask a good friend who you trust. I mean, it's hard to find your tribe. Or come on over to me. We have a whole community. Our dysregulation solution is about, really, it's a repository of super easy to use solutions, and you get access to me. It's probably going to be soon one of the only ways to get access to me. Or you could work one-on-one with me. But nobody ever regrets getting help. They only regret when they don't. And I hope this was a conversation that got you thinking a little differently about the behaviors that you see, those understimulated behaviors that maybe you're thinking is ADD or a learning problem or anxiety, or those overstimulated behaviors you're thinking is ADD, a mood disorder, oppositional defiant, and everything else in between. Again, it doesn't mean they don't have those clinical issues. It means that there are things that are impacting it and making it worse. Aha moment there. So I look forward to hearing more about the ways you are helping your child regulate your nervous system.